Assalamu alaikum. So I am Kasim Jaskani. We solve MCQs. So this is a SPSC master book for nurses. This is a very smart and brief book which cover all the syllabus of SPSC and other testing services. So the first portion of book is theory, and second is the MCQs. After the reading theory, you can easily understand the MCQs and prepare yourself. And we are also starting online classes through our academy, so you can join our academy. Interested candidate are invited. Fees structure is 5,000 for 2 months. We will provide notes, recorded lecture, live lecture, MCQs test on daily basis, weekly tests, and cover the weak areas of each candidate separately. So we are going to solve MCQs. The MCQs number 24. The disease which the disease in which bronchial tube become narrow due to the spasm of bronchial muscle. Option A, influenza. Option B, asthma. Asthma is the correct option. Option D, diphtheria, and none of these. In asthma, the inflammation and muscle tightening around the airway occurs of bronchial tube. Due to it, the patient feels suffocation and respiratory distress. The option B is correct option. The diphtheria leads to difficulty in breathing, as we discussed in previous lecture. The option question number 25: which of the following medicines is administered to patient suffering from diabetes? The any patient who are suffering from the diabetes, we treat the hyperglycemia with the insulin. So option B is correct option. Penicillin is antibiotic extract from the fungus Penicillium notatum. The insulin is one of the hormone of our body which is produced from the pancreas, the beta cells of pancreas. Option C, sulfa drugs. What are the sulfa drugs? Sulfa drugs are sulfonamides. Sulfonamides are the type of the antibiotic. And option D is streptomycin. Streptomycin are also antibiotics. Question number 26: which of the following is not a vaccine preventable disease? A, polio. Polio is also vaccine. Polio vaccine. B, hepatitis B vaccine is available. Injurex B and other vaccines. Asthma. Asthma is the correct option. Is the C. There is no vaccine for the asthma. Option D is measles. There is a vaccine for the measles also. Question number 27: which disease mainly affect the children under 5 and remain endemic in only 2 countries? So polio is the disease which occurs under 5-year children, and the polio disease is eradicated from the worldwide, but 2 countries, Pakistan and Afghanistan, are currently suffering due to polio. Some cases are occurring in Pakistan and Afghanistan in current years. Option A, rubella. Rubella is also called German measles. Polio is the disease which is endemic. The endemic disease are those diseases which are occurring in few areas and in some time. Pneumonia is a respiratory tract infection and respiratory disease. The fluid filled in the alveoli of lungs. Measles, we have discussed in previous lecture. Question number 28. The biggest challenges to the improving global vaccine coverage are. So the challenges occurring for the improving global vaccine coverage: limited resources. Due to the limited resources, vaccine cold chain is not maintained, vaccine are not brought at the time, vaccine is not available everywhere. Number B, competing health priorities. Due to the lack of health priorities is given to other sectors. This is also challenge. Poor management of health system. There is also a shortage of staff, shortage of transport, shortage of electricity. Poor management of health system. The corrupt authorities, mafias, and all of these. So the answer is all of these. Question number 29. An attenuated vaccine is composed of. There are many types of vaccine, but four are main types of vaccine. Killed microorganism or killed vaccine. Killed vaccine are example of killed vaccine is pertussis. Number B, a living weakened microorganism. Living weakened microorganism are also called attenuated vaccine. So there are example of attenuated living or weakened microorganisms: measles, mumps, rubella means German measles, rotavirus, smallpox, chickenpox, yellow fever are the attenuated type of the attenuated vaccines. Number C, inactivated bacterial toxin. Inactivated bacterial toxin vaccines are hepatitis A, flu, polio, and rabies. Number D, purified macromolecules vaccines are Hib, influenza vaccine, pneumococcal vaccine, shingles vaccine, and hepatitis vaccine. Then toxin, here the inactivated bacterial toxin. Bacterial toxin are the vaccine also called toxide vaccines. The diphtheria and tetanus are the most common example of toxide vaccines. The question number 30. Vaccine are available for all of the following except. Vaccine are available for the all of following. Hepatitis A vaccine is also available. Hepatitis B vaccine is also available. Hepatitis C have no vaccine. Tetanus vaccine, tetanus toxide are available in DPT. Now the DPT is converted into pentavalent vaccine. So we will come with the new lecture and very uh, important MCQs, inshallah. So on daily basis I try to share with you many important MCQs, and some of from are repeated, and I will try to mention those as I mention the repeated MCQs and their detail. We not only solve that 5 to 10 MCQs, but we discuss many things during reading and comprehending these MCQs. So inshallah we will come with new lecture, and you are interested candidate are advised to join our online classes. We will learn much more during online classes, inshallah. Allah Hafiz.